Department from Beacon Hospital.
Okay, hari ini kita sangat beruntung bisa dengan Dr. Irene di sini ya. Dr. Irene adalah ketua dari tim clinical research di Beacon Hospital dan Dr. Irene sendiri adalah PhD holder.
Yeah, I'm PhD holder. I'm PhD in the molecular medicine, and it's my honor to be the contribute in the clinical research department in Beacon Hospital.
How big is the team of clinical research in Beacon Hospital?
Okay, so basically, at this moment we have a team of 8 of us in
It's quite a big team.
Yeah, because we really would like to provide all support and help all the patients in every clinical trials, and hopefully every of them can be benefit in each study.
I see. Doctor, would you maybe can elaborate to us why that Beacon actually emphasize that we have a clinical research department as one of the center of excellence?
Okay, so maybe I give some of the history a bit. Okay, Beacon Clinical Research Center was actually established or formed in year 2008, and it was transformed into one of our center of excellence in year 2020. The objective actually is to make the Beacon Hospital to be the global trusted hospital with the integrity and ethicals of conducted clinical trial. So therefore, we actually have a whole team, a big whole team of a clinical research team, so can provide the full support and conduct clinical research in accordance to good clinical practice under the auspice of principal investigator. So which means that we actually will be make sure the whole process from the patient's recruitment until the end, the process is fulfilled to ethical principles. It is follow the clear detailed protocol, as well as everything is under control.
Wow, amazing. I mean, I can hear from you that for having this clinical research team itself at Beacon Hospital, we put a lot of effort, dedication, time, and everything, one team work together. And I believe your team also, you have the head of the team, which is that our oncologist doctor.
Yeah.
May I know who is the head of the clinical research department?
Head of clinical research department.
My meaning is it Dr. Toyman?
Dr. Toy is the head of oncology department.
Yes, but I heard that he actually also oversees the clinical research department.
We actually have been working closely with the oncology teams,
Okay.
and it's also our honor to work with Dr. Toy, which is one of the leading lung specialists in Malaysia.
Okay.
And we actually have been working a lot and collaborate in a lot of the clinical trial, and happily to see that many successful cases.
I see. All right. Doctor, may I know that how actually clinical research enlighten and able to help patients treatment?
Sure. So clinical research actually is a type of study, or it's a type of research to study the new treatments or new technology with the objective to evaluate the effectiveness and safety on patients. So here I would like to take a chance to emphasize a bit. Clinical trial is not experimenting on patients, but it is about to determine the new standard of treatments.
I see.
So there are hundreds of the new and promising cancer treatments are only available to the patient in clinical trial. So therefore, by participating in the clinical trial, it actually allows the patient to assess the leading edge of the cancer treatments. So actually it will be helpful to the patients, because this may be the most promising option for the cancer patient today. And this is also very helpful and critical to speeding the development and approval of the new drug for more patients in future.
I see. I think this is a very benefit for the patient. And one more thing that I heard that okay, for example, drugs, let's say that you use for the clinical research for the patient. Yeah, we already know the successful rate is very high. Let's say in a Western country, or you can know that the successful rate is very high. And over here, we are doing for the research. This type of drugs, meaning the possibility of the giving the treatment to be successful is also very high. And if let's say they're not getting their, under clinical research, they won't be able to get these drugs. Am I right?
Yes.
So am I saying that, if you got money, you want to buy this drug, you also won't be able to get it. But if you under the clinical research patient in Beacon Hospital, you will get this drug. Am I right to say
Yes,
that?
yes.
Okay.
It's actually until the drug being marketed, then everyone only have the chance to access the drug easier. But before the drug is being gotten the approval, then not everyone can have the access to the drug.
I see. Okay, that's also how it's benefit as
Yes,
well.
yes, yes.
Yeah. Okay. Beside that, for example, Beacon Hospital, I understand that even like for immunotherapy, for example, the treatment when it's still not approved yet, and we in Beacon Hospital, we already has done the clinical research early in 2016. Am I right to say that?
Yes.
So that's actually how that to show that our doctor, they are really expert in the treatment, that although still not really, usually the doctor has already started the treatment in Beacon Hospital. Yes. Okay, doctor. Sorry. Cut.
3.
No, aku mau bicara. Halo, selamat pagi. Saya Nani dari Beacon Hospital dan di samping saya adalah
Hi, selamat pagi semua. My name is Irene. I'm
Dr. Irene.
Dr. Irene. I'm the head of department from the clinical research department from Beacon Hospital.
And Dr. Irene ini adalah seorang pemegang PhD juga yang mengetuai tim clinical research di Beacon Hospital. Dokter, saya selalu dengar kalau dari Beacon Hospital itu punya banyak pusat keunggulan, ya. Dan salah satunya pusat keunggulan kita itu adalah clinical research team kita, ya. So saya mau tahu dokter, kenapa di Beacon Hospital menjadikan pusat penelitian ini sebagai satu pusat keunggulan dalam rumah sakit?
Yeah.
Ya.
Okay. So maybe I give some of the history. Beacon Clinical Research Center was actually formed in year 2008, and it was then transformed into one of our center of excellence in year 2020. And the objective actually to make the Beacon Hospital as one of the global trusted hospital with integrity and ethical conduct clinical trial. So this means that we actually have a whole team of the clinical research staff who will be there and provide the support and conducting the clinical research in accordance to the good clinical practice under the auspice of principal investigator. So we also make sure that the whole process from the patient recruitment until the end of the study, the process will actually is fulfilled to the ethical principles, sound scientific, as well as follow the clear detailed protocol.
Baik, Dr. Irene, terima kasih atas penjelasannya. Dan Dr. Irene, yang saya tahu seperti dokter bilang tadi, itu memang dalam penjelasan yang sangat sempurna, ya. Tapi dalam pelaksanaannya, dengan saya yang lihat sendiri, menurut saya itu sangat perlu dedikasi, waktu, dan juga yang perhatian yang kita berikan kepada pasien yang ikut dalam clinical research kita. Dan itu adalah salah satunya menurut saya itu yang di Beacon Hospital itu yang kenapa kita membuat ini semua, dan sampai sekarang pencapaian kita di Beacon Hospital.
Yeah, about the achievement, we actually would like to thanks for all the our patients for trusting us, the oncology team and our clinical research team, and with everyone's efforts, and we actually have been really literally contribute to numerous of the clinical trial and impressive number of the oncology drug launching in Malaysia. And we also be proud to be the top clinical trial site in private setting in the field of oncology in Malaysia in year 2021.
Wow, itu merupakan satu kebanggaan bagi tim clinical research di Beacon Hospital yang merupakan kontributor yang paling banyak untuk dalam sektor private hospital, terutama dalam bidang onkologi. Dan itu memang luar biasa pencapaiannya. Karena dengan pencapaian begini, kita bisa tahu bahwasanya Beacon Hospital itu betul-betul meletakkan usahanya yang paling bagus, yang paling baik untuk pasien, ya. Jadi obat yang terbaru, pengobatan yang terbaru, itu semuanya dalam clinical research kita juga, ya. Dan seperti pernah kita dengar juga, biarpun kalau kita punya uang, belum tentu kita bisa dapat membeli obat yang dalam clinical research study, ya. So ini juga salah satu poin, biarpun kita sudah tahu tingkat keberhasilan untuk respon obat ini juga sangat tinggi, dan kalau di luar kita tidak akan dapat, kecuali kita mendapatkannya dari penelitian. Ikut seperti sebagai kriteria dari pasien untuk mengikuti clinical team study kita, ya. Dan dokter, satu lagi pertanyaan, sebab yang kita bicara ini semua adalah ya orang Indonesia yang ingin mendapatkan pengetahuan bagaimana seseorang itu bisa memenuhi persyaratan untuk dijadikan sebagai pasien untuk mengikuti clinical research study di Beacon Hospital. Dokter bisa jelaskan?
Clinical study actually have their own standard outlining who can participate. So the standard we call it as an eligible criteria, and those factors that allow the participants to join the study we call it as an inclusion criteria, and those factors that disqualify someone from participating we call it as an exclusion criteria. So this factor actually will be looked to the patient characteristic such as the age, gender, type, stage of disease, the previous history of the treatments, as well as the other medical conditions. And each clinical study may have a different criteria. Therefore, for those who are interested to know more, you are welcome to talk to our oncology or reach out to us for more information.
So, coba saya simpulkan ya. Jadi kalau seseorang itu, dia itu merasa dia sudah pergi ke banyak tempat untuk mengobati dan merasa obat yang dia berikan oleh dokternya sekarang tidak ada responnya sama sekali dan tidak memberikan kebaikan atau penyembuhan yang lebih baik untuk yang kanker utamanya, untuk yang sakitnya sekarang. Apakah pasien ini boleh datang ke dokter kita untuk menyatakan bahwa saya ingin mendapatkan obat yang baru, dan ini setakat ini saya sudah mencoba banyak obat dan tidak ada yang sesuai, dan ini kita minta nasihat dari dokter. So itu dari awal mulanya bagaimana pasien itu kemungkinan bisa dijadikan calon sebagai pasien yang sesuai dengan kriteria atau tidak, ya. Baru disesuaikan oleh dokter dengan tim.
Ya, seperti yang saya jawab tadi, different study have a different criteria.
Yeah.
So if we have certain conditions, like for example, you have been diagnosed with the lung cancer, and you have been filled a lot of medication in a different like you have been tried on different medications, right? But still couldn't get the results. You are welcome to reach out to us and look into and access into our website. And that is a different. We have listed out the different clinical study. You can look into it, and welcome to just call to our center and talk to us. Welcome, we will be here anytime to provide the support and help you and get you to get the treatments.
Itu betul-betul bagus sekali. Itu betul-betul kesempatan yang luar biasa untuk pasien di luar yang merasa sudah mungkin obatnya itu sudah pengobatan sudah lama dan tidak ada kebaikan. Silakan ke website kita untuk menanyakan pertanyaan ini, ya, dan kita akan menentukan dan menjawab pertanyaan Anda apakah Anda adalah calon pasien yang sesuai untuk kita masukkan ke dalam tim research kita. Dan dokter, pasti dari clinical study kita itu dapat menyimpulkan bahwasanya clinical study ini banyak membantu pasien dan itu adalah tujuan utama kita.
Ya.
Ya. So dokter boleh nggak share dengan kita dari clinical research ini itu bagaimana manfaatnya untuk pasien?
Okay, so before that, maybe I give a little bit of overview of background of what clinical research is. Clinical study actually is one of the research to study the new treatments or new technology with the objective to evaluate the effectiveness and safety on patients. Here I also would like to take the opportunity to emphasize that clinical trial is not about experimenting on patients, but it is about to find the new standard of treatments. And there are hundreds of the new and promising cancer treatments are only available to the patient in clinical trial. Therefore, by participating to the clinical trial, you may have the chance to assess the leading edge of the cancer treatments. And this is very important because this may be the most promising option for the cancer patient today, and this also will be helpful and very critical to speeding the development and approval of the new drugs for more patients in future.
Wow, Dr. Irene itu betul-betul bisa membantu sangat banyak pasien dengan apa yang Dr. Irene sebutkan. Jadi manfaatnya clinical research study ini untuk pasien itu akan memberikan pasien itu untuk mendapatkan satu pengobatan yang paling sesuai untuk pasien. Karena di dalam clinical study itu ada beratus-beratus beragam pengobatan yang bisa kita terapkan kepada pasien, ya. Dan biarpun pengobatan itu adalah pengobatan baru yang belum terdapat lagi, tapi di Beacon Hospital kita bisa mendapatkan tes itu. Dan seperti Dr. Irene tadi sebutkan, ini bukan percobaan kita kepada pasien, tapi ini adalah penelitian clinical research kita terhadap obat dan juga pengobatan yang sesuai untuk pasien. Ya, dokter ya.
Yeah.
Oke. Dan yang saya tahu juga pencapaian Beacon Hospital itu kan untuk clinical research itu sangat luar biasa, dokter. Dan setakat ini sudah banyak effort yang kita masih letak dan perhatian untuk pasien. So dari menurut dokter pencapaiannya sampai saat ini mungkin dokter bisa share dengan kita.
Macam mana?
Just now actually we did
We
this
did
one.
already.
Oh sorry. Cut. Okay, I said so nasihat kita itu, I said
Okay.
when I said nasihat kita itu, then fight for cancer,
Don't give up.
Ya.
Okay. Okay. 1, 2, 3, action.
Dan ini menyimpulkan semua presentasi kita tentang clinical research. Untuk itu, pasien terutama pasien kanker, fight for cancer,
Don't
don't
give up.
give up. Thank you.